Hello, this is Dr. Rana Mondal. Today we'll discuss about Transvaginal Oocyte Retrieval TVOR or ovum pickup OPU, an essential step in the in vitro fertilization IVF process. This procedure involves retrieving your mature eggs from the ovaries, which are then fertilized in the laboratory to create embryos. Let's dive deeper. TVOR is a minimally invasive procedure where needle is guided through the vaginal wall into the ovaries to aspirate oocytes from the ovarian follicle. It is a key step in IVF that follows after ovarian stimulation. In IVF procedure, usually gonadotropin drugs are given to form your eggs. This injection varies in dose and duration depending on the patient's ovarian reserve, BMI, age, but usually given for around 11 to 14 days, after which you will be given a trigger injection to mature your eggs. TVOR is an elective and scheduled procedure, and it is typically performed 34 to 36 hours after the HCG or any trigger injection, when your eggs are fully mature but just prior to the rupture of the follicle. On the day of the procedure, you need to admit to the fertility clinic or hospital. Your doctor will guide you through the procedure again, and an anesthetic team will brief you about the type of anesthesia will be given. You will stay in a pre-operative room before taking to the procedure room. In pre-operative room, they will ensure that you have avoided drinking or eating anything 6 to 8 hours prior to the procedure. They will review your medication and the current medications you are taking, and your personal hygiene will be checked. We recommend to take a bath before coming to the clinic. Your blood pressure, heart rate, and temperature and other vital parameters will be checked, and an IV line, intravenous line, will be inserted for administration of the fluids and anesthetic. Then you and your partner's identity will be cross verified, and all the documentation and formalities will be completed, and the consent forms will be re-verified. Then will be taken to the operative theater, which will be adjacent to the IVF lab. You will be placed in an operative table in a lithotomy position with your legs strapped. Typically, light sedation or conscious sedation or anesthesia is used. In some cases, general anesthesia is used to patient comfort. A transvaginal ultrasound probe equipped with a guided needle will be inserted into the vagina, and a quick scan will be performed to see everything is okay or not. The doctor will visualize your ovaries and check the access of the needle to your ovary first. Before going to the actual procedure, your doctor will verify some important things like the suction of the pump will be checked and it is functionally okay or not, and also the pressure will be checked. Connection between the needle and aspiration tubing are examined for any cracks or leaks. An ultrasound probe, protective sheath, and needle guide are inspected to ensure proper placement, and a mock aspiration is performed with the culture media to ensure all systems are working correctly. During this procedure, an ultrasound guided operator inserts a 16 to 17 gauge outer diameter needle through the vaginal wall into the ovarian follicle, taking care not to injure any nearby organs or blood vessel. The outer end of the needle is attached to the suction device. The needle is passed through the posterior vaginal wall or fornix. There should be minimum gap between the ultrasound probe and the ovarian cortex. Once the follicle is entered, the suction is carefully applied to aspirate follicular fluid containing the cellular material, including the oocytes, that is your egg. Suction device must maintain pressure of minus 100 to 140 mmHg. It is necessary to aspirate rapidly but not enough to damage the follicle. A temperature of approximately 37 degree need to be maintained throughout this procedure. After collecting the follicular fluid from one follicle, the needle will pass to the another follicle without damaging the ovarian cortex. Usually, the operator, after collecting the follicular fluid from one follicle, withdraw the needle little bit just outside of the ovarian cortex, then again re-entered into the another follicle. The procedure continues till the all follicular fluid has been collected from each of the ovaries. It is very crucial to minimize the vaginal wall puncture as much as possible, as it will provide less pain to the patient, as vaginal wall is a sensitive structure, and also chances of bleeding will be less after the procedure. This procedure typically lasts for around 10 to 25 minutes. The follicular fluid immediately handed over to the embryologist in the IVF lab for oocyte screening. Embryologist will identify and isolate the oocytes under the microscope. The oocytes are then placed in the culture medium to prepare for the fertilization. It is our aim to get as much as or mature oocytes, because we can use this oocyte for fertilization, because germinal vesicle and M1 has minimal chance for fertilization with the sperm. These collected oocytes will be taken for IVF insemination or ICSI, that is intracytoplasmic sperm injection, depending on the fertility parameters and the partner's semen parameters. Post-operative procedure: you will be shifted to a recovery room where your vitals will be monitored for around 1 to 2 hours, and any signs and symptoms will be closely observed. You will be encouraged to pass urine after 1 hour. You will be instructed to avoid any kind of strenuous activity for 24 hours, drink plenty of fluids and take rest. You need to follow the prescribed medication, including antibiotics and pain relievers. And you will be asked to report any kind of symptoms such as severe abdominal pain, heavy bleeding, fever, or anything that causing discomfort to you. Although TVOR is very safe procedure and usually don't have any kind of significant complications, but the common complications are mild cramping and pelvic discomfort. Sometimes you have a spotting or light bleeding for around 2 to 3 days. Some uncommon complications are infections can happen, and sometimes allergic reaction to any medications can also happen. Injection of HCG, if used as a trigger, can have high risk for ovarian hyperstimulation syndrome, especially if your ovarian reserve is much more or you are having a polycystic ovarian syndrome. There can be other complications of TVOR includes injury to the pelvic organ, hemorrhage or internal hematoma formation. Sometimes infection can also occur internally. Ovarian torsion or ovarian hemorrhage can occur after this procedure, but it is a very rare complication. Usually you will be discharged after 4 hours from the procedure, and you will be given a leaflet to follow. Thank you for watching this video, and if you have any question or concern, please ask us.